how to connect and study. Like if you look at my posts, I think there is a reel of mine, the first reel that I uploaded. I never thought that it will become so viral. It's like 9,90,000 people have played it. In that I talked about proton pump inhibitors and association with and a risk of worsening of osteoporosis in menopause females. Because as I said in that video, estrogen and calcium are best friends. So in menopause, estrogen gets reduced, so automatically calcium also gets reduced. So if you are using proton pump inhibitor for a long time, proton pump inhibitor also reduce the calcium level much more. So you can, understand what will happen with those kind of patients. So basically, if you want to correlate things like this or connect the dots like this, you should first understand the physiology of the body. Anatomy you know very well, but physiology is important. Unless and until you understand what is the function of a particular receptor or a particular tissue or a particular organ, you will never be able to understand what will be the effect of a particular medicine when it acts beneficially on that organ or when it acts harmfully on that organ. So basically you need to understand the physiology first. So whenever I study, I first target the physiology. After that, when I go to pharmacology, I can connect the dots, because unless I know the effect of estrogen on the body, how will I say that proton pump inhibitor can increase the risk of osteoporosis in menopause females? I cannot say that. Another question that people ask me that, for example, I said that proton pump inhibitors increase the risk of osteoporosis in menopause females. So then the next question that I saw in the comment section, and many people asked me also, that so what should we do? Should we stop the medicine? I never asked you to stop the medicine. So for this you need to understand a medical term which is known as risk versus benefit ratio. Risk versus benefit ratio. What do you mean by that? Let me give you an example. If you are suffering from epilepsy, or if you encounter patients suffering from epilepsy, you know very well, we give a lot of medicines for seizures. We have valproic acid, we have phenytoin, we have fosphenytoin, we have carbamazepine, we have oxcarbazepine, we have lacosamide, blah blah, whatever it is. But if none of the medications are working, then one of the last resort or one of the last medications that we go for is felbamate. You may have heard about it, felbamate. And why is it the last choice? Because felbamate has a problem. It causes aplastic anemia, which is a very dangerous form of anemia. Aplastic anemia means your body is unable to produce blood cells. And it also causes very, very severe hepatotoxicity. And that is why it is the last choice. So for example, if I tell you that felbamate causes hepatotoxicity and felbamate causes aplastic anemia, but if you see a patient who is not responding to any anti-epileptic medication, there is no other option. You may have to use it. So basically, whenever you decide the choice of a medicine, we always look at the risk versus benefit ratio. If you have a better alternative, then you can go for that alternative. If you don't have a better alternative, then just manage the side effects that may happen. You can prevent it by some supportive measures and you can carry on with that medicine. Otherwise, every medicine has so many side effects. Every day we get new informations about. In fact, recently I just saw in a notice that ceftriaxone can prolong QT interval. In fact, ceftriaxone is such a commonly used medicine and it can prolong the QT interval. So every medicine has so many effects. It doesn't mean that you can stop all medicines together at the same time. The patient will die. So this is something that I wanted to tell you.